Hey, good morning, everyone. So welcome to our BPharm program, our Bachelor of Pharmacy program admission talk. My name is Eliza Tam. I'm a registered pharmacist in Hong Kong and also in Australia. I'm also the admission tutor for the Bachelor of Pharmacy program. So in today's sharing, hope to introduce to you about pharmacy for those who don't know what we do, and the role of pharmacists in Hong Kong. There are some unique features if you're considering to do pharmacy degree to our Hong Kong U Pharmacy curriculum. We will also share with you our department and faculty support for our students. And also lastly, the admission requirement. And we will have a consultation section open for you to ask any questions at the end. We also have our E4 student Marshall here today, who will do some sharing about student life. So that will be right at the end. So let's talk about the role of pharmacists in Hong Kong. So we are proud of ourselves to be the pharmacy expert in medication. We practice in hospital, clinics, community pharmacy, NGOs, pharmaceutical companies, Department of Health, and also drug offices as well. So there's a variety of roles in both community settings, so in primary care setting, also in hospitals, and also there are some government positions that our students can take up as well. So just a brief introduction about our pharmacy program. It was launched in 2009 and it's accredited by the Hong Kong Pharmacy and Poisons Board. They are the regulators for pharmacist registration in Hong Kong. It is a 4-year program. So once students has finished the 4-year program with us, they will go into 1-year internship, either at a hospital or at a community setting or at a accredited site by the Pharmacy and Poisons Board. Once they finish that 1 year of internship, they will get a license in Hong Kong. So they will be a registered pharmacist in Hong Kong. We have approximately 35 to 40 students as an intake per year. Our latest admission number last year was about 38 students. So just a bit on more about the role of pharmacists in primary care. So as most of you are aware, we in Hong Kong, we are having the primary care initiative. So we are trying to roll out that for primary prevention, it should be done in a local setting rather than in the hospital. So actually, in the role of community pharmacy, we are already doing this already. So we have responded to symptoms. So if a patient comes in with minor elements, we can actually give them advice in a community pharmacy. We have drug dispensing. So if you have a prescription from the doctor, we can dispense the medication for the patient and also do some counseling with them as well. So perhaps some of you, maybe the parents has picked up medications from hospitals before. They will spend 30 seconds explain to you about medicines. But in a community setting where we can spend more time with you explaining the side effects, the indication, and what you would expect on a medication. So we can have a more time and we get to know our patient better. Drug information inquiry. So sometimes you might wonder which drug is better for you. According to the patient's condition, we might recommend different therapies. So for example, in diabetes medication, there's about 20 different options that's available on the market, but different patients have different needs. So some patient may be an elderly, they might have a different needs to someone newly diagnosed with diabetes. So as a pharmacist, we know all these considerations and we can give advice to our patient. Also, we are involved in health promotion and disease prevention, especially in district health center. So some of you may already know that it's already been piloted, and we are hoping that in each of the district will have a DHC very soon. Lastly is patient empowerment and self-care. So I always tell my students as well, we can give the best advice and best drug to our patient, but if they don't adhere to your advice and they don't know about their disease state, they are not likely to be adhering to what you say. So patient empowerment to us is a very important element in the care of the patient. So this is a brief summary of the career prospect. You can also have this slide from our department website as well. So I encourage you to have a browse of our department website. We have a lot of information on our website and our social medias. So as I mentioned earlier, you can go into hospital, Department of Health community pharmacy. So those are more a frontline care to the patient. Also, you can go into academia. So we have students joining us today who's doing their PhD with us. We have students doing PhD abroad as well. So they can go into different institutes to pursue their career. Pharmaceutical industry, so perhaps some students will be interested in doing research and development, so R&D. So they can actually go into pharmaceutical industry. We have students who are interested in marketing. They can actually have a career there as well. Others such as a medical writer or working in a non-profit organization will be another prospect for our students as well. So if you are interested in doing a pharmacy program and becoming a pharmacist in the future, then the next question is why choose us from other programs that you might be interested in. So next I'm going to talk a bit about what's the unique features of our program for your consideration. We are very proud to have an authentic learning experience at our exclusive pharmacy teaching sites. So we have 3 sites currently, and we are planning to have more that are exclusive training for our BPharm students. So first is the Gleneagle Hospital. So this site will exclusively train our BPharm students, and you get to see the role of pharmacists in a hospital. On the left-hand side, we have one of our lecturer, Dr. May Lam, who is a practitioner there, training our students. And Gleneagle Hospital is a hospital that's down at Wong Chuk Hang, for those who don't know. So it's a training site for our faculty, and then we send our students there to have a experiential learning and also learn on site as well. Also, we have 2 other exclusive site for our community pharmacy training. One is at Health in Action, 醫護行者, and this is in the Kwai Chung district. This pharmacy is actually quite unique. It's a pharmacy that's open to the public. They serve, of course, the local district population there, and they do a lot of work with the minority groups as well. So we hope our students will get to know a variety or a spectrum of different patients, because these are the patients that they will deal with most of their time when they are working as a pharmacy professional. Another pharmacy close by that's exclusive for our teaching purposes is the A Lively Community Pharmacy. This pharmacy is actually the closest to us. It's at Hua Fu Chun. So we serve the elderly population there, and it's a pharmacy that's open to the public as well. They also do a lot of health education to the public, because as you know, the elderly may not know a lot about their drugs. So the elderly can actually bring the drugs there, have a chat with the pharmacist, and our students are there working alongside with the pharmacist there as well. So we actually have 3 exclusive teaching sites that's, inside our community, that's to help to train our students. Of course, we have other training sites as well. So our teaching partners at Queen Mary Hospitals, so you get to train as the inpatient and outpatient pharmacist there. Our students actually get to go to the ward from year 2 onwards. So we actually take students to the pharmacy and actually to the patient ward to review patient cases from year 2 onwards. Students also get to go to the chain pharmacy, so the bigger community pharmacy where we have a very close relationship with as well. So they get to train there and work alongside with the registered pharmacist there too. On the far right-hand side, it's a health district center. So in the picture, it's one of our students giving talks to the public. So we actually let them to have talks under the supervision of pharmacists to the general public. We hope to train future roles of pharmacists. So our department really focuses on training the future roles of pharmacists, not just training pharmacists who can suit their roles now. We actually look in beyond what our roles are now and train them for the future. So we have training for vaccination. So we perceive, because from the overseas model, so if you look at overseas model for pharmacy education, vaccination is one of the roles for pharmacists. So we hope that in one day, students can have this role in Hong Kong. So we're actually putting this in our curriculum now. So our graduates are actually trained for vaccinating patients. At least they will have the knowledge in doing so if there's the opportunity that's open in the future. Communication skill is very important in all aspects in healthcare providers. So from a very young young age and in the curriculum, we train our students to have a good communication skills. So every year, students will go through an interactive examination. So they get to talk to or counsel an actor. So the actor may have some disease state or may have a problem that they want to ask the student as a pharmacist. And then from then on, we can pick out the improvement that they can do throughout the curriculum. So hopefully by the end of year 4, they are a competent pharmacist, not just on their knowledge, but also on their communication skills as well. And other features of our program, which is quite unique to us, is the enrichment program. So after 4 years of training or 3.5 years of training, our students are quite equipped with knowledge and communication skill that they need. But we hope that they understand the society needs as well. So in the last semester of year 4, students will get to attach to an NGO, a non-pharmacy practice site, and they get to work there twice a week as a worker. Okay. This actually will give the students a taste of working with others, so the collaborative environment, and also understand what our society really needs, because we find that when our students, they are in a very protective environment in the university, but they don't know what's happening around the world. So we hope the students can go outside and have an experience working with different people. So on the picture on the far right-hand side, it's one of our graduate, and Donald, he went to an NGO called AIDS Concern. Okay, so they deal with a lot of educating people about AIDS, HIV, and hope to clear out some of the misconceptions. So he was giving a talk to a minor ethnicity group in Hong Kong. Okay, these people still think that kissing can make you pregnant. So this is one of the feedback that Donald was giving us. So you wouldn't know that this still exists, particularly in Hong Kong, but they do. The middle picture, it's Claire, who's our graduate last year as well. She actually really enjoys baking and making things. So she went to a NGO or a social enterprise called Golden Times, I think. And this particular social enterprise, they helped women in need, and also retire women to have a job and promote traditional Chinese pastry. So then they actually employ these women to make pastry, but it's not just the job satisfaction that they get the connection with the community, and they get to collaborate with the young people as well. And Claire was very involved with the marketing of the products, and also she get to talk to the elderly as well, which will help her to in her future career, because she will be serving a lot of elderly in her career as a pharmacist in profession. Left-hand side, on top, it's Gladwin. He was actually attached to District Health Center. So he was doing some health promotion and actually having a chat with elderly about their blood pressure issue. So that could be one of the potential sites that our students will go to as well. So we hope for enrichment module, the students not only picking up the communication skills, but they also know what our society needs. And we are not only training students to be a pharmacist, we hope to broaden their mindset to contribute a lot more to our society in the future. So in summary, our program, this is actually quite unique to our curriculum. It's what we call a pharmacy experiential education program. In short, it's called PEP. So in year 1 to year 4, students will be exposed to different authentic learning. So for example, in year 1, we actually asked our alumni and the different sector stakeholders to come and do some sharing with our students. Knowingly at this stage, if we send our student out, they will be quite nervous because they haven't learned anything pharmacy related yet. So we actually invite speakers to help our students to understand more about the roles of pharmacists, and perhaps they will get to know which pathway that they want to pursue in. E2 and E3 experiential learning site. So I mentioned about the different community sites, the hospital, etc. Our students will get to work as a worker there actually 1 day a week during the curriculum in E2 and E3. So this is actually very unique to our program and to our curriculum. Because you're not there just as an observer. So in the past, we found that we send our students to site, they just stand on the side and watch the pharmacists, and they don't really learn anything. But when they are there as a worker, they get to talk to the patient, they can counsel the patient under supervision of pharmacists. They get to work with other people in the workforce as well, which we hope to increase the students' employability in the future, because it's very hard for them to get experience during the time that they're here with us. Lastly, in E4, students will expose to clerkship and enrichment. And enrichment I've already mentioned. So clerkship is quite unique to us as well. Students will spend 2 days a week in one semester at a placement site. So 2 weeks they will go to a community pharmacy. 2 weeks they will be attached to a hospital, and another 2 weeks they will be going to an industrial site. So they will go to an industry company and work there as a worker for 2 weeks. So we actually strategically place this clerkship in the last year of the curriculum. It's because we know that students will need to choose their internship placement at that time. So at least they have exposed to the different sectors, then they can make a wiser choice of their career path in the future. Another strength of our faculty is we have interprofessional education. So this is one of the photos taken at the at one of the education seminars that was taken place last year. So students get to work alongside with medical students, nursing students. We have social workers, we have Chinese medicine students, and in one of the modules that we've completed last year on COVID-19 pandemic, we actually invited civil engineering students as well, because of the the structure of the buildings in Hong Kong and how crowded we're in Hong Kong. So each of the discipline, they can contribute to a real patient case. So it's a very unique opportunity that students will get to know the people that they will work with in the future, basically. So they will resolve a case together. They will come up with a plan to work together as well. We are also training future researchers. So perhaps some students would like to pursue the career in master's degree or in the doctoral degree, and in the future become an academia and research and into research. So each of our students are required to do a final year project under the supervision of one of our teachers. So this is mandatory, and then we hope the students will get to know and articulate the importance in doing a project and also a research. On the right-hand side, it's there are 3 of our academic staff, and our department head, Professor In Wong, is there as well. We actually have done a lot of research during the COVID-19 times, and the research that they have done are actually influential to the government policies. So I'm hoping to illustrate to you that our students are actually under the supervision and under the guidance of researchers and scholars such as Professor Wong and all our other colleagues who contribute to our society's needs in the time that they needed. Another strength of our program is there's an articulation to Hong Kong U MBBS program. So if students would like to go into the MBBS pathway, they can actually complete the 2 degrees in 8 years. So students will need to be high performers. They will need to have a satisfaction score in the interview, in the MBBS interview, and then they will go into MBBS non-JUPAS route. Okay, once you've entered into the MBBS program, you will be exempted for year 1, and you will be exempted for year 3, which is the enrichment year. Okay, so this is not a guarantee, but in case that you are admitted into MBBS, then you will have 2 years less than your other peers in completing the MBBS program. Also, our department are quite proud in sending our students to do exchange opportunities. So we hope all our students can at least have one chance during their 4 year with us to explore the world. We hope the students have a broader mindset, not just what's happening locally, but they also know what's happening internationally as well. So we have sites such as in UK, US, some of you may want to go to Japan. We actually have 2 sites in Japan that students will be attached to. Canada, Australia, France, and also in China as well. So students will be doing this exchange program in summer. The attachment ranges from 1 month to 3 months, so depending what the site needs. And it's a time that we really see them growing up because they will need to take care of themselves. They will need to troubleshoot things themselves. And it's a really great way to see them grow as well. Next, I'm going to talk about our department and faculty support to our students. Our staff diversity is local and beyond. So myself, for example, I was trained in Australia, and I've worked in Hong Kong for over 10 years now. So we have teachers who are trained in different parts of the world, hoping to bring the best practice to our students and incorporate that into our curriculum. So we have teachers from UK, US, Canada, Singapore, and also China as well. This is actually quite new to our program. We have what we call a teacher practitioner. So we have 4 of our staff who are actually working in a community or in a hospital site half-time, and then they will bring their practice back to our students. So our teaching is most up-to-date practice because that's what's happening at their teaching or at their working site. So we are actually quite proud of this because we hope our students will be the most up-to-date when they come out to the workforce, not something that we learned about 20 years ago. And also just some features about our program. We have academic advising, which each of the students who's admitted to our program will be assigned to a teacher to provide advice and guidance on their study, on their internship. And sometimes if they have problems with their studies, we can also give them advice as well. So each of the students will be assigned to an academic advisor. So in case they have any problems, they can approach us. We have a small teaching student ratio as well. So our cohort is about 35 to 40 students. So it's a small class size model because we hope that we can focus on our students and we can better cater for each student's individual needs. So some students are more proactive in talking and some students are more reserved. So we hope that in a small class teaching environment, we can encourage the students to speak up more and to train up their communication skills. So for tutorial classes, we normally have about 1 teacher to about 6 to 7 students per group. So we can really take care of our students in this small class model. Then we'll be on the admission requirement. The scoring formula for JUPAS is any basic subjects among the category A subjects in the DSE. You will need to do the 4 core subjects plus 2 elective. M1, M2 maths will be counted as 1 elective. Okay, and remember that we use the Hong Kong U scoring system. So your DSE score will be translated to a Hong Kong U program score according to the marks that you get in your DSE. So for both non-JUPAS and JUPAS, our requirement will be having a chemistry component. So either chemistry as a subject or in a combined sign-in with chemistry component is required. We believe that chemistry is very important in our pharmacy curriculum because you will need to know the drug action. So the students will have to have this basic background before they enter to our course. The students will have a working level in Cantonese. This is because we have a lot of opportunity for our students to work in the community. So it will be very difficult for them if they do not have a working level of Cantonese. And also there's a satisfactory performance at our interview. So I'll talk about the interview a bit later. So our admission score for last year, so this is just for reference. So for DSE, it's 36. This is with the bonus score system. So this is not the raw score. This is the bonus score. IB will be 37, and the GCE A level will be 2A star, 1A. Okay. And this information is actually in our post-practice. If you don't already have one, you can pick up one on your way out. So how would we select students with the same DSE or same score? So we actually look at other sources as well. So interview performance is important because, as I mentioned earlier, we actually place a lot of emphasis on communication skills. So we hope our students can have that skills already before they come in, and we can train them better. Level 7 and 8 category subjects, the category C subjects, and also the principal nominations, etc. So these are, if you have the same score as your peers, how would we rank you and for admission purposes? So these are just the tentative dates for interview. So for non-JUPAS candidate, the first round will be December 21st. And for JUPAS students, it will be in June. And also we will have another round in July as well. So there are 2 rounds for DSE students, also 2 rounds for your non-JUPAS students. But make sure you need to put us as Band A, because if you put us as other bands, we won't interview you in the first round. Now, this year we have a new interview arrangement. So this is similar to the MBBS arrangement if you went to the admission talk. So we will divide the interview into 2 parts. Each student will have a chance for individual interviews and also for group interview as well. So the rotation will be students will go into a 1-to-1 interview with one of our teachers, 1 4-minute question in English, 1 4-minute question in Chinese. And the students can say about their personal experience on how they view the questions and answer the question in English and in Chinese. After this 8 minutes interview, the students will go into a group interview. So we hope the students has a collaborative skills as well, working with others. They can encourage others to speak while they can explain their points of view as well. So the group interview, it's really good for communication skill and for collaboration skill. So these 4 candidates will sit with an interviewer, and then we just let them speak. We read the question, let them speak, and they can talk to each other. And this conversation will go on for 8 minutes. And it's one on an English conversation topic that the student can discuss. They can raise their point of view, and then they can debate with each other as well. So before I hand over to Marshall to talk about his experience with us, the information day today, so we are at the admission talk now. At 12 o'clock, we will open the consultation rooms where you can get to meet our students, our other staff, and if you have questions about admission score, admission purposes, you can speak to our admin staff as well. So that will open from 12 o'clock to 6 o'clock tonight. Okay, it will be in seminar room 1 to 2, which is just down the corridor here. Go straight. There will be 2 rooms there, and we actually have another admission talk at 3:30, which will be in Cantonese. So if you are interested to join us again, 3:30 will be in this room again. We also have some demonstration and workshops as well at different times. So I'm not sure if the registration is still open because we're quite full last time that I heard, but you get to see what we do in practice and in our experiments in the curriculum. And we have teachers guiding you there as well. Okay, so we are quite active in our social medias. So if you would like to follow us, you can follow us on the different social medias, and also our website has a lot of different information for post-practice students, and also our structure of our curriculum. Okay, then I will hand over to Marshall. Thank you.
All right. Hello, everyone. So I'm Marshall. So I'm a final year pharmacy student here. So today I'm going to share with you my experience as a pharmacy student here. So sort of like what I've gone through these 3.5, 4 years or so. So these are my experience here in the pharmacy program. I'll talk about them one by one. The highlighted events are the events that are arranged by our department. So again, I will talk more about my experience or my viewpoints of them later on. So let's go back a few years. Back in 2020, that's where I begin my journey in the pharmacy program. So COVID lockdown still all taking place. So this is where exactly where I begin in the HKU intranet system. So sort of an online learning system, but we are getting adapted to that system already. But as time goes on, COVID gets better. We still get a lot of sort of face-to-face lectures, experiments, practical sessions. So one of them on your right is a practical session that is designed by students and executed by us as well. So it's an extraction of caffeine from tea leaves. So it's an experiment that we designed. And on your left, right on my left is the picture of my classmates. So we've met them real life a few times. So this is one of the few moments that we met together. And fast forward a bit to the summertime. So as a year one student, we haven't got much of the clinical knowledge yet. So my thinking is like, why not go to a research team that, because I can still read, I can learn to write stuff, I can learn to look at data. So what I did is to join a big data research team here in HKU Pharmacy. So what I did is to write articles, read some literatures, and look at some data as well. So that is what I did for the summer. And at the end of that summer, I also went to the community vaccination center. So what I did, I didn't do the vaccination part, but I did a very important part is to communicate with the patient or to be vaccinated. So I counsel them on what are the vaccine side effects and how to manage them. So this is the sort of things that are sort of the first experience I did as a pharmacy student to sort of communicate with the patient, to introduce them to the knowledge of using vaccines. So moving on to year two, it moves on to a more hybrid approach and online lessons, face-to-face lectures, combining together. So one of the highlights events is the white coat ceremony. So that should have been in year one, but due to COVID, it sort of postponed to my year two. So it's sort of very similar to medical students. They do an oath to, we do that in pharmacy as well. So this is the white coat ceremony, and being in year two, having the white coat ceremony with the then year one students, so I get to meet a lot of the younger cohorts. So get to meet them, get to know them as the younger cohorts. So moving to year two, at the end of year two, summertime, my thinking is like, why not join another research team? Because in year two, we learn the fundamentals of something very important to pharmacy, which is pharmaceutics. So it involves the making of raw medicine chemicals to a deliverable products to the public. So this knowledge I learned in year two, I think it's a very interesting topic. So why not I join another research team to learn more about them. So this is a collaboration between HKU and Science Park. So I joined that research team. And what I did is a project on how to make nanoparticles that can be delivered from the nose to the brain. So this is what I did on a day-to-day basis. And then in the middle is the product that we made. And then in order to know more about the product, so we put in the machine to sort of have a better understanding of our product. So this is my daily routine as a student researcher back in year two. And at the end of that summer, I still have some time to join another logistic company, so DCH Origa. So it is a company that is designated for the handling of dangerous drug and most importantly, the COVID vaccine. So I get the experience to observe their daily practice and also involve in the daily practice as well. So moving to year 3, I would say is a highlight of my academic year so far. It is the experiential learning that Eliza have mentioned before. So I was very fortunate enough to be allocated to a clinic in Central, so Hill Medical, 希悦醫療. So I worked in the pharmacy for a couple of months. So this is what I've experienced in the clinic. So I get to learn the pharmacy operation in there, and most importantly, to communicate with other medical professionals like doctors, nurses, and even some of the non-medical staff like office clerks. So these experience, I would say I have 2 takeaway points during my time there. So first is the early exposure. So I guess this is including me and other pharmacy student. Experiential learning is going to be their first time actually going into a pharmacy, working inside a pharmacy as a student. So the earlier we get the exposure, the more easier for us to adapt to later jobs, summer jobs, interns, and even full-time staff. So it sort of eases us into that process. And the second thing I would say I'll learn is the pharmacy operation. So the day-to-day and operation. So I would say that these are the things that we cannot learn in the lesson. But I want to clarify that it's not something that our lecturers doesn't have the capability to teach, but it is a very important experience that we can only learn from outside experience from working inside a pharmacy. This is something that pharmacy operation doesn't have a standard formula. You cannot have because it varies a lot from different pharmacy. It depends on their scope of service, their resources available. It differs a lot from different pharmacies. So having students working in different sectors actually helps them to have an idea what an actual pharmacist will do in the future. So another activity I did is pharmacy exhibition. So it is a student-led pharmacy education program for general public. So last year, our topic is to teach the general public on how to use their cold and common cold and flu medication. So how to safely take them with their own current medication or etc. So teaching them the basics to manage themselves properly. Sort of ongoing theme with the primary healthcare, the patient empowerment. So to give a patient more knowledge in handling their medication. And for semester 2, if you have been coming to a lot of the pharmacy information day, you might have seen me previously as a student helper as well. So in year 3, semester 2, I sort of did a lot of helping roles in here. And for the summer job, I would say this is another highlight of my years. So the first, this has happened in June, this year, June. So I worked in a community pharmacy, the teaching pharmacy, Health in Action. So in there, under the supervision of pharmacists, I was able to communicate with patients through minor ailments, medication counseling, and health monitoring, like those blood pressure monitoring, blood glucose monitoring. And another part of my duty there is the health promotion. So sort of, again, patient empowerment, giving them more knowledge to sort of handle their disease and medication. So at that time, I did a topic on stomach illness. So how to notify you have some stomach illness, what are the common remedies available to them, and when to see doctors or when to seek another form of healthcare when the condition worsens. So teach them how to manage themselves. And for the July, I work in another community pharmacy. I would say the job experience are kind of similar, but the more exposure I get, the better practice I get, because working with different pharmacy, different pharmacists, working with different clients actually allows me to pick out a lot of good practice from different places, put them together, improve myself. So basically an amalgamation of different places, different practices. And at the end of the summer, I went to Queen Elizabeth Hospital as a summer volunteer. So what I did is mostly dispensing works, but I also get some exposure from the clinical pharmacists on what their roles in the hospital, including sort of like oncology service, infectious disease, heart problems, renal problems. These sort of problems all pharmacists can involve in. I get a taste of what those are like in the hospital. So lastly, closing to current times, it is the clerkship activity in year 4. So as mentioned before, we have 3 sectors for clerkship, 2 weeks each. So industry, hospital, and community. So up to now, I have done 2 out of 3 clerkships, including the industry and the community. So for the industry, it mostly involves the regulatory affairs and medical affairs, including sort of like how to regulate the medication, the pharmaceutical products under the Hong Kong laws to make them safe and effective to use. And the medical affairs involved like selling of medication with scientific knowledge. That's a very important part, scientific knowledge. And then community clerkship, again, similar with previous experience, get to interact with patient as well. And lastly, hospital clerkship mostly will be visiting case presentation, for shadowing clinical pharmacists, what they do in a daily practice. And this is sort of almost to the end. We have the high table dinners. Of course, being a pharmacy student isn't just about studying, it's about socializing with other peoples, and including the whole high table dinner and the medic high table dinner, which I met some new friends there. And lastly, upcoming events for me is the enrichment activity, which will be in the next semester. So I'll be looking forward to that. So that's the end of my sharing as a pharmacy student here. So I hope you enjoy my sharing, and to appreciate that the department has offered a lot of things on table for us students, future students to explore, to enjoy more. So that's the end of my sharing, and I hope you have a nice day here in HKU. Thank you very much.